Health Insurance 101, How to Choose the Right Plan. Is health insurance even worth it anymore? Here's what they don't tell you. I know that's a bit of a provocative question, but it's one I've seen pop up more and more in the healthcare forums I frequent. And honestly, it's a valid one. After all, why would anyone want to spend hundreds, sometimes even thousands of dollars on insurance when they're young, healthy, and seemingly invincible? But here's the thing. One bad accident, one sudden illness, and that decision can be the difference between manageable bills and a financial nightmare. And trust me, navigating the American healthcare system is no small task. If you've ever found yourself buried under confusing jargon like HMO, PPO, Copay, Deductible, out-of-pocket maximum, and all the other buzzwords, you're not alone. Today we're going to unravel all of that. We're going to dive into how to choose the right health insurance plan so that you can save money, protect your finances, and, more importantly, ensure you're getting the coverage you actually need. Hi and welcome to US Healthcare Explained, where we teach you not only how to protect your wallet, but also how to understand the mind-boggling intricacies of the American healthcare system. Before we get into it, don't forget to subscribe and hit the notification bell so you don't miss out on future tips that could save you thousands. Why health insurance is still necessary, even if you're healthy. Let's get one thing straight. For most of us, insurance is a gamble. You're betting that something bad is going to happen, while the insurance company is betting that it won't. If you win, you're covered. If they win, they pocket the premiums. So it's no surprise that some people think, why bother? Especially when you're young and invincible, the idea of paying a hefty premium every month for something you rarely use can seem, well, wasteful. But here's the thing. One big accident, one medical emergency, and you could be hit with tens of thousands of dollars in medical bills. And in America, these bills can come out of nowhere. I remember reading a story on a Reddit forum where a guy shared how his brother, who didn't have health insurance, got into a simple bicycle accident. A broken arm led to hospital fees, x-rays and surgery. The total bill? Over $15,000. Without health insurance, he was drowning in debt. This is why, even if you don't use it often, having insurance is your financial lifeboat when the unexpected happens. Key takeaway, health insurance is less about frequent use and more about protecting yourself from the catastrophic costs of unexpected medical issues. The basics, what you need to know about health insurance terms. Before we get into the actual process of choosing a plan, let's talk terminology. Because trust me, these words matter. I've had countless people tell me they wish they'd understood these better before picking a plan, because it would have saved them from choosing one that didn't actually meet their needs. Here are the key terms you need to know. 1. Premium. This is what you pay every month for the privilege of having health insurance. Even if you don't use any services, this amount is non-negotiable. 2. Deductible. The amount you have to pay out of pocket before your insurance starts covering services. If you have a $1,500 deductible, that's what you'll pay up front before insurance kicks in, with a few exceptions like preventive care. 3. Copay. This is a fixed amount you pay for a healthcare service. For example, you might have to pay a $30 copay every time you visit your GP. 4. Coinsurance. After you've hit your deductible, you'll still be responsible for a percentage of your medical bills. If your plan has 20% coinsurance, you'll pay 20% of every bill, while the insurance covers the remaining 80%. 5. Out-of-pocket maximum. This is the absolute most you'll have to pay in a year. Once you hit this amount, your insurance covers 100% of your medical expenses for the rest of the year. 6. Network. The group of doctors and hospitals your insurance will work with. If you go out of network, expect to pay a lot more, or even the full bill. I recently came across a story from a young woman who had to pay over $5,000 for a surgery that should have been covered. Turns out her surgeon was out of network, but she didn't realize it at the time. This is why understanding your network is so crucial when picking a plan. How to choose the right plan for you. Now that we've covered the basics, let's talk about how to choose the right plan for your specific needs. The biggest mistake people make when choosing health insurance is not considering their lifestyle and health requirements. There's no one-size-fits-all, so it's important to think about what you and your family actually need. Here's how to approach it. 1. Assess your health needs. Are you generally healthy? If you don't visit the doctor often, you might want a high-deductible health plan, HDHP, with a lower premium. You'll save money up front, but be prepared to cover most of the costs if you do need care. Do you have a chronic condition or ongoing medical needs? If so, consider a plan with a lower deductible and better co-insurance. You'll pay more in monthly premiums, but you'll save when it comes to actually receiving care. I saw a comment on a forum from a man who chose the cheapest plan because he was trying to save on premiums. A year later, he was diagnosed with diabetes and suddenly had hundreds of dollars in out-of-pocket costs for medication and doctor visits. He wished he had chosen a plan with better coverage for regular care. 2. Understand the types of plans. When it comes to health insurance, you'll likely come across these common plan types. HMO, Health Maintenance Organisation. These are usually the cheapest plans, but you're limited to in-network providers and need a referral from your primary care doctor to see a specialist. PPO, Preferred Provider Organisation. More flexible, as you can see specialists without a referral and go out of network, but it comes with higher premiums and sometimes higher deductibles. EPO, Exclusive Provider Organisation. Similar to HMOs, but you don't need a referral to see a specialist. You do, however, still have to stay in network. HDHP, High-Deductible Health Plan. These plans are linked to a health savings account, HSA, and they tend to have lower monthly premiums but higher deductibles. Best for people who are healthy and can afford the high upfront costs if they do need care. One woman I read about in a healthcare forum opted for an HMO plan because it was cheaper, but regretted it when she had to wait weeks for a referral just to see a specialist. She ended up switching to a PPO the next year because she preferred the flexibility, even if it meant paying a bit more each month. 3. Compare premiums, deductibles, and out-of-pocket costs. Now that you know what kind of plan you're looking for, it's time to compare the details. Don't just look at the monthly premium. Consider the deductible and out-of-pocket maximum, especially if you're someone who requires regular care. Let's say you're deciding between two plans. One has a $200 monthly premium and a $5,000 deductible, while the other has a $400 premium and a $1,000 deductible. If you rarely use medical services, the first plan might work fine. But if you anticipate a surgery or frequent doctor visits, you could save more by paying the higher premium for the lower deductible. Hidden costs to watch out for. Alright, so you've picked a plan. But wait, there are always hidden costs lurking around the corner. One of the most surprising things I've found while researching is how seemingly simple services can quickly add up, even if you think you're covered. Here are some sneaky costs to keep an eye out for. 1. Out-of-network charges. Even if you have a PPO plan that lets you go out of network, the costs can still be astronomical. Make sure your doctors, specialists, and hospitals are in network whenever possible. I came across a post where a woman was shocked to get a $2,000 bill for an anesthesiologist who turned out to be out of network, even though her surgeon was in network. Always ask up front. 2. Prescription drug costs. Not all health plans offer great prescription coverage, especially for specialty drugs. Double-check your plan's formulary, the list of covered medications, to make sure the prescriptions you need are covered. If not, you could be paying out of pocket. One guy on a forum mentioned his surprise when his prescription cost jumped from $30 to $150 after switching plans. Turns out his new insurance didn't cover his brand of medication, and he had to work with his doctor to switch to a cheaper alternative. 3. Specialist fees. Remember, just because you have a plan that covers specialists doesn't mean you're in the clear. Many plans require higher copays or co-insurance for seeing a specialist compared to a regular doctor. Always check these rates before scheduling your appointment. Final thoughts. Picking the right plan is personal. Don't rush it. Choosing the right health insurance plan can feel overwhelming, but taking the time to research and compare your options is the key to saving money and ensuring you're covered when you need it most. Remember, there's no one-size-fits-all. Your choice should depend on your health needs, budget, and preferences for flexibility. And if you ever feel stuck, there's no shame in reaching out to a healthcare advisor or even your HR department for help. If you found this guide helpful, don't forget to subscribe to US Healthcare Explained for more tips on saving money and navigating the complex world of healthcare. And hey, let me know in the comments if you've ever had a medical bill, horror story, or some insurance advice to share. We're all in this together. Quick recap. Understand your health needs and usage before picking a plan. Learn the differences between HMO, PPO, EPO, and HDHP. Compare premiums, deductibles, and out-of-pocket costs. Watch out for hidden costs like out-of-network fees and prescription prices. And remember, subscribe if you want more deep dives into healthcare and personal finance. See you on the next one.